When we talk about scoliosis and its associated pain, you hear a lot of information about it, and a lot of it's misinformation and confusion because scoliosis and pain is not necessarily associated with every patient, meaning that not every patient that has scoliosis will experience pain. And it also depends on the age of patient, how much curves have progressed. There's a lot of factors involved, but let's kind of break this down into a simple concept in terms of what we do understand when it comes to scoliosis and the causative nature of pain, and why some patients are experiencing it and why some patients are not, and why some patients with smaller curves are experiencing pain while patients with bigger curves are not. So first of all, let's talk about adolescents. Adolescent cases, it's number one, not common that they experience pain. Now, it is common that they may experience a dull ache at site of curve during progressive time, and that sometimes can lead to the diagnosis of scoliosis, but sometimes they don't experience no pain at all, zero. They can have a relatively large curve and have no pain. And the reason why most kids are experiencing no pain during the progressive nature of scoliosis, even though their curves can be quite large, is because the progression is due to growth, and growth leads to an elongation. This elongation or the growth within the spine doesn't compress nerves, doesn't compress discs, doesn't compress all these things. So there's no pain associated with the curve developing. In fact, the biggest curve I've ever seen in an adolescent case has been 155 degrees, and this patient had zero pain associated with scoliosis. So you can see that it's not always common. Now, there is cases that patient could just have scoliosis and have pain. Now, unfortunately, as these curves continue to progress, they eventually get to a point where the pain becomes so severe that these types of treatments are no longer effective, and now they resort to something more invasive like surgery. Now, when it comes to surgery, there's two types of surgery in scoliosis patients that are experiencing pain. One is going to be, I like to call it the symptom-based surgery. The symptom-based surgery is where they do a small surgery in the area that they believe is leading to the pain, like a little segmental fusion, or maybe a discectomy or something along the line, where they're trying to deal with the effects of the scoliosis on the spine. And those tend to be like surgical band-aids. They tend to last very short term. Things tend to come back very quickly, and the curve is still there, therefore it's still progressing. And then there tends to be the full scoliosis surgery, where they go in there and they fuse the spine, where they remove multiple levels of the spine, up to 12 different types of vertebra, and they're putting screws and rods in the spine to try to reduce the curve and hold the spine from further progressing. Now, the problem when it comes to this type of surgery is that it's very complicated, especially as you get older, which is the most common type of patient that is experiencing pain as a result of surgery. So this type of, because of scoliosis, is receiving pain because of scoliosis. This type of surgery in the adult patient is very complex and can lead to multiple complications as a result of the surgery itself. So a lot of times you can have this surgery to try to help you with pain, and you can end up with more pain as a result of surgery, or even a different type of pain. So it can be very tough decision for a patient to make when they know that this could be a factor. And then the older you get, the more complications that you tend to have. So what I like to talk about is something about a functional approach to scoliosis. Because we know one thing: if we can improve function of the spine, we can definitely improve the body's ability to heal and stabilize the spine and deal with all the effects associated with scoliosis, and not have to go through all the risk associated with scoliosis surgery. What are some functional approaches? Functional approaches to dealing with scoliosis can be like exercise, stretching, chiropractic care, therapy, rehabilitation. There could be lots of things associated with dealing with a more functional approach. One common thing is I have people come in my office and say, well, I'm going to start exercising. And what they mean by that is like, I'm going to start working out. I'm going to start doing strengthening my core, do abs, do low back exercises, kind of like do weights, those types of general exercise. Now, I definitely believe general exercise improves the function of the body, but general exercise alone is never considered a treatment for scoliosis. Even though it could help the body function better and may help some things, the curve itself is still there. General exercise has never been shown to reduce a curve, make a curve straighter, and ultimately deal with the cause of the problem, which is leading to the scoliosis. Stretching tends to be a very common thing. People start doing stretching things. Now, don't get me wrong, stretching, I believe, is important. Improving flexibility of the joints and muscles and tissues of the body could help people feel better. But it's, again, not dealing with the causative factor of what's leading to the issue, which is the size of curve. Thirdly, is people go to chiropractors and they get adjusted or do therapy and they do like a little bit of therapy and rehab. And again, these things could help reduce pain, but if they don't deal with the actual structure of the spine to reduce the curve, it tends to be short-lived. The way I like to explain it is there's a very difference in treating a person with scoliosis who has pain as opposed to treating somebody's scoliosis, which is causing the pain. When you're treating the scoliosis, the goal is to reduce the curve. Therefore, reducing the curve helps eliminate what the person's experiencing as to dealing with what the person's experiencing and not addressing the curve. That philosophical difference is what really determines how well your outcome will be and if you're going to truly alter the progressive nature of the scoliosis. So what's my advice when it comes to somebody dealing with scoliosis pain? Number one, if you're an adult, you want to deal with the size of curve. You have to reduce the curve, because if you're not reducing the curve and just dealing with the symptoms associated with scoliosis, the ultimate cause is worsening. Your problems will more likely worsen, and you can be dealing with more effects as you get older. And unfortunately, dealing with a more drastic types of measures like surgery. If you're an adolescent with pain, then I would recommend you reduce the scoliosis as quickly as possible and not let the curve get any bigger, because if you're having pain as an adolescent, I would say it's much more likely you can continue to have pain as an adult resulting in your scoliosis. It's never too late to start dealing with scoliosis treatment, and especially when it comes to a more functional approach to reducing scoliosis. You definitely explore all your options in reducing scoliosis, and more specifically, find somebody who can coordinate all these approaches to get the very best outcome for you and your spine.